Today, we're diving into a really powerful first-person account of a motorcycle accident and the totally surreal 36 hours that came after. Now, this isn't just a story about a broken bone. It's a raw, inside look at the chaos, the humanity, and honestly, the incredible strain on a public hospital's emergency services. So, let's get into it.
So, it all kicks off on a completely normal day, January 12th. Our narrator is just heading to work on his motorcycle, and then, bam, disaster. He hits a patch of oil on the road. He says the feeling of losing all control was just indescribable. It was, in his own words, like his bike just suddenly hit a sheet of ice. The crash was brutal, and his knee was completely shattered.
So there he is, on the ground, in the middle of traffic. Right away, people rush over to help, forming a sort of human shield to protect him from the cars while someone calls for an ambulance. He's taken to Beatrice Angelo Hospital, and this is where his real journey into the healthcare system kicks off.
And you know, here's the really surprising part. For the first 2 hours, the system worked like a dream. I mean, he crashes at 10 a.m., he's at the ER by 11, and by noon, just 1 hour later, he'd already had an x-ray, gotten a diagnosis for his fractured knee, been put in a cast, and even sent off for a CT scan. All the critical, urgent stuff was done. It seemed perfect.
But, well, just as quickly as that efficiency showed up, it completely disappeared. He gets moved out into the orthopedics corridor, and that's when a long, almost surreal wait begins. This is the moment, he says, that he stopped being a person and started being just another patient.
He describes this as a huge loss of identity. I mean, think about it. Your clothes, your personal belongings, they're all taken from you. You're handed a standard-issue hospital gown, plopped on a gurney, and with his knee, he couldn't move. He became essentially just a body waiting in line. And all around him was the raw, unavoidable suffering of other people in the same boat.
And the scene in that hallway, wow, it was a pressure cooker. You've got 3 or 4 patients, including him, completely bedridden, and to care for all of them, just 1 nurse and 1 aide. You could just feel how stretched thin they were, even though they were doing their absolute best.
So in this hallway, he's lying right next to an elderly man with dementia who kept pleading to go to the bathroom every 5 minutes. Now, at first, the narrator admits he was judging the staff pretty harshly, thinking they were being cruel for not taking him. But after a few hours, he saw what was really going on. They were taking the man to the bathroom about every 15 minutes, but the man would immediately forget, and the whole cycle would start again. That moment just completely shattered his initial judgment and showed him the draining, complex reality that staff deals with day in and day out.
It's not until around 8 p.m. that he's finally moved from that corridor into the main emergency room. And what he finds there is a whole other level of chaos. He calls it an inferno, a sea of gurneys, just packed together, with a tiny handful of staff trying to manage dozens and dozens of patients.
And yet, right there in the middle of what he calls pure hell, the constant noise, the pain, the overwhelming lack of resources, he found something absolutely incredible. He found angels. And those angels, he says, were the doctors and nurses.
He starts to see these incredibly human, poignant moments. At one point, he overhears a 90-year-old man who's clearly delirious talking to his mother. And the way he was talking to her, the narrator calls it a brutal tenderness. For 40 minutes, he just listened to this deeply personal, loving, one-sided conversation with someone who was almost certainly gone for many, many years. Later that night, he really needed a glass of water, but he didn't want to yell and wake up the other patients who were finally asleep. So he just used his phone's flashlight to signal a nurse. She came right over and she wasn't annoyed at all. She was just unbelievably kind. She told him her name and said, "You can call me by my name. Whenever you need me, just call." He was just stunned by that level of compassion in the middle of all that chaos.
Finally, after a really long delay, they get in touch with his work insurance. A transfer to a private hospital is all set up, but it's not going to happen until the next day. This delay, though, is what sets up the most dramatic shift in his entire experience. All in all, from the second he arrived to the moment a new ambulance came to get him, he had spent 36 hours in that emergency room. 36 hours, on a gurney, just waiting. When he finally gets to the private hospital, the contrast is just shocking. It's immediate. He goes from that sea of gurneys to his own private room, from an overwhelmed staff to nurses who had time to ask if he was comfortable, from a dinner of bread with butter to a full, proper meal. It was, as he put it, 2 completely different worlds.
Now, seeing a difference that stark, it would be really easy to just say, okay, public is bad, private is good. But his reflection on it all is so much more nuanced, and this is where the story gets really, really interesting.
He starts to put his 36-hour ordeal into a much bigger global perspective. He points out that in a lot of other countries, especially the United States, an accident like this, if you don't have the right insurance, would mean total financial ruin. The treatment he got, even with all the discomfort, would have been impossibly expensive.
And this leads him to a pretty surprising takeaway. He prefers the Portuguese system. Yes, it's got massive flaws. Yes, it was uncomfortable, chaotic even. But at its core, it's a system that treats everyone. No matter who you are, you get cared for, you survive, and you don't have to go bankrupt to do it.
And really that leaves all of us with a fundamental question about what we actually value as a society. What's the better model here? A flawed, often uncomfortable system that acts as a safety net for absolutely everyone, or a perfect, efficient system that's only available to the people who can afford it? It's a trade-off every country has to think about, and we just saw it through the eyes of one man over one very, very long night.